there is a close association, the right statement. Coming next, lymph nodes of labia majora, repeating again and again. Medial group of superficial inguinal lymph nodes. Well, I have discussed in my previous videos with explanation. Let's suppose this is the inguinal, let's suppose this is femur, or you can say the groin. So the lymph nodes are divided into two, the superior group and the inferior group, and superiorly again divided into two, the medial group and the lateral group. So this is the medial group, into which superficial inguinal lymph nodes, but the medial group. Letrozole is aromatase inhibitor. Antigonadotropin hormone released in dark melatonin. It actually decreases the TSH and FSH. That is why it's called antigonadotropin. 2-point discrimination mediated by lateral inhibition. Bronchopulmonary segment, that is by trunk tertiary bronchus, not bronchioles. So you have to pay attention on this, because there are MCQ in which there are mentioned tertiary bronchiole. That is the wrong answer. This is tertiary bronchus. And there is another MCQ in which the answer is functional unit. Yes, this is the functional unit. This is the basic unit, or you can say the structural unit. It is the basic unit of the lung. Another MCQ is that it has got its own arterial supply, and the segment on the right side is equal to the segment on the left side. Segment on both sides are equal. Structural damage during hysterectomy is ureter. Case of sickle cell anemia, type of mutation, this is point mutation. Even in the thalassemia, the beta thalassemia, again point mutation. The alpha thalassemia, deletion. Beta thalassemia and sickle cell anemia, this is point mutation. If someone is interested in having a reference, I will share it from USMLE. So beta thalassemia and sickle cell, you are having point mutation, while in alpha thalassemia you are having deletion. Diagnosed case of respiratory defect in which part of, coming next, the answer is membrane of RBC. Wernicke's aphasia, in which there is less sense. Less sense mean no comprehension. No comprehension. So Wernicke's aphasia, there is no comprehension, but there is speech. Type of necrosis in heart and kidneys. Solid organ usually have coagulative necrosis. Coagulative. Liquefactive seen in infection, abscess, and brain. Fat necrosis is seen in omentum and pancreatitis. Fibrinoid necrosis is seen in the hypersensitivity type 3 reactions, in which there is antigen antibody deposition in the blood vessel, usually seen in SLE and other autoimmune diseases. Anti-emetic drug suitable for chemotherapy is ondansetron, that is onset. Azoospermia, investigation is now you are having testosterone plus FSH and plus LH. You have to look for this option. If the question says best next step, the answer is testosterone. If the question says only investigation, then the answer is FSH and LH. Over here the answer is right. Aspermia mean aspermia, no sperm, mean no ejaculation at all. Aspermia, nothing comes out of the penis. Azoospermia mean there is ejaculation, but that has got no sperm. Artery damaged pelvic brim, highly repeated ovarian. Anti-tumor cells, the natural killer cells are the anti-tumor cells because they destroy the tumor cell. Bad taste in the mouth, later followed by thick vaginal secretion. So bad taste in the mouth is typically caused by metronidazole. Coming next, case of diagnosed hypothyroidism, investigation for choice is TSH. Pelvic splanchnic is equal to parasympathetic. You see there are least error in this paper, but my purpose is to explain you so that you can study smart. That is the thing. Good analgesia but slow anesthesia, that nitrous oxide, So you have to use it in combination with other anesthetics. Primordial germ cell migrate to gonadal ridge in 6th week. Now discussed in detail in my previous lecture from where they arises, and also it is detailed by Iske in one of his initial paper that I uploaded in my last video, regarding when they originate, regarding their route. They are transported through dorsal mesentery and then to the ridge and then finally into the gonads. You can watch in my previous video. Submandibular and submental node, then it is the lip carcinoma. Lip carcinoma. Lower lip or upper lip? The answer is lower lip. Posterior part of thyroid gland left for, answer is parathyroid. Superior thyroid surgery damage narrow is external laryngeal is most commonly damaged. Now there is another MCQ. If external laryngeal nerve is damaged, it affects what? It affects what? It affects the quality of voice. What is meant by quality of voice? The voice become either grave or shrill. Shrill mean when there is increased tone in this muscle supplied by external laryngeal nerve. When that is paralyzed, the voice become grave, because the vocal cords inside, they are kept tight by this nerve. I think the muscle is cricothyroid muscle, the only muscle which is supplied by external laryngeal nerve. The cricothyroid muscle, I do not remember the proper name, but there is a muscle outside over there. The function is to when that pulls, when that is contracted, it causes increased tension in the vocal cord. When the vocal cord are tensed, then it will produce what? The shrill sound. Shrill sound का मतलब ये है कि एक बारी आवाज़ होता है, दूसरा बारी का जो उल्ट होता है. तो बारी का मतलब ग्रेव है. ग्रेव एक बारीक आवाज़ होता है, तो ये बारीक आवाज़ पैदा करेगा. जो ग्रेव है वो बारी आवाज़ पैदा करेगा. वो जब पैरालिसिस हो जाएगी इस नर्व की, तो ये लूज हो जाएगा. जब ये लूज हो जाएगा तो वॉइस विल बिकम ग्रेव. Coming next, cause of osteoporosis, osteoclast activity. Cause of osteoporosis, osteoclast activity. अच्छा, osteoclast activity by parathyroid hormone. The parathyroid hormone causes increased osteoclast activity. Pain of appendicitis caused by, now over here it is caused by prostaglandin and bradykinin. Now there is another MCQ, that is the referred pain of appendicitis is carried through T10 sympathetic. T10 sympathetic. But if there is MCQ, a patient is having appendicitis and pain is around the umbilicus. Whenever there is a pain around the umbilicus, it is carried again in T10 sympathetic nerve. This is called the active learning. But if there is MCQ, a patient was having pain around the umbilicus, now the pain is shifted toward the right iliac fossa. The pain is carried through which nerve? Now over here, the answer is not T10 sympathetic. That is the referred pain that is caused by T10 sympathetic. Over here, you are having inflammation of peritoneum, parietal peritoneum, and the nerve that are stimulated now is actually the same dermatome, the same nerve. That is, which dermatome lies in the right iliac fossa? That is T12. T12 to L1. T12 to L1. Over here, there is another MCQ that is coming to my mind. The MI referred pain is carried to the medial aspect of the right upper arm. That is to T2 dermatome. The MI pain referred to the T2 dermatome. Through which nerve? The nerve is called intercostobrachial nerve. Intercostobrachial nerve. This is the name of the nerve. And the pain of the MI enters into the spinal cord through which nerve? Now coming toward that. The upper 4 thoracic nerve. T1, T2, T3, T4. That is called greater splanchnic nerve. So you see, you are having different things coming out. Similarly, in cholecystitis, the referred pain to the tip of the shoulder, that is through phrenic nerve. C3, C4, C5. The major contributor is the C4. So to the tip of the shoulder, that is C4. To the tip of the shoulder, that is C4. That is C4. And if the pain is referred to the right subcostal margin, which nerve is inflamed? Now, which dermatome lies in the right subcostal region? That is, if the nipple is T4 coming down T5, T6, T7, this is almost, if umbilicus is T10, so you come up for T10, T9, T8. That is almost T8, T4, T5, T6, T7, T8. That is almost T8. The purpose is to open your mind. Atopic asthma, which is seen in the cell eosinophilic leukocytosis. Patient with has HbA1c positive or others negative. Coming next. Patient is having what? Acha, hepatitis C antibody is positive. If only hepatitis C antibodies is positive, what does it mean? If only antibodies are positive, then the answer is D. Past exposure to hepatitis B. Now the core antibodies of hepatitis B are IgM and IgG. If the IgG is positive, if only antibodies is mentioned, the answer D is right over here. But if is mentioned IgG, again the D option is right, past exposure. But if it is mentioned IgM, then the answer is window period. Window period. Window period. So if the hepatitis B core antibody is positive, but in that they have not mentioned the IgM or IgG, then you have to pick the past exposure. But if the IgG is positive, this means past exposure again. But if the IgM is positive and the IgG is negative, it means what? It means window period. And what is meant by window period? Window period means the disappearance of the HbS antigen and the appearance of HbS antibodies. This is called window period. And during window period, the only test that is positive is IgM antibodies. So you are getting more MCQ. Now this MCQ I have mentioned on my Facebook page with reference. If the question says first analgesic effect after TCA, first analgesic effect after TCA, that is 1 to 2 weeks. 1 to 2 weeks. Maximum analgesic effect, that is 4 to 6 weeks. That is 4 to 6 weeks. Now their analgesic will be seen in how much time. Now if the question is like this, I would pick the 1 week, because they are not talking about the maximum analgesic effect, they are talking about the analgesic effect. Patient with maximum transmissibility of hepatitis B infection. Now this is the right answer here, but HBe antigen positive and HBe antibody negative, because it means high replication. If there is high replication, there is high tendency toward the transmission. There is another MCQ related to this. Transmission from the mother to the baby, again, if HBe is positive, is high. Most common type of hepatitis in Asia, that is hepatitis A. Neural crest derivative, dorsal root ganglion. Transmitted by mosquito bite, yellow fever. Bladder carcinoma caused by schistosoma hematobium. Case of patient with increased plasma cell in bone marrow but no Ig formation. Now if you see in multiple myeloma, you are having IgG spike. IgG is sky high. In monoclonal gammopathy of unknown origin, you are having IgM spike. You are having IgM spike. The right option over here is C, variable immunodeficiency. Because if there is immunodeficiency, the plasma cells are stimulated again and again. The number of plasma cells increase, but they are unable to produce antibodies. Undercooked meat infection is tapeworm. So if you are having any problem, you can ask in the comment section below. So please watch my videos. and share them. Bilateral temporal, then this is the middle part or central part, that is the right. Upper motor neuron lesion sign is exaggerated reflexes. Dormant phase in malaria, hypnozoites. Pressure in the right ventricle just before opening of pulmonic wall. Just before opening of pulmonic wall. Now the pulmonic wall opens when the pressure in the right ventricle exceeds 8 mm. Right answer over here is 8 mm. That is missing. The right answer is missing. If the 8 is not, then you choose the option toward the closer to the 8. So over here I will pick the option A, 12. If the question says pressure in the right ventricle just before closing pulmonary wall, so the answer is then 25. This is the maximum systolic pressure, and this is called the ictal learning. Patient took primaquine for malaria and developed anemia with Heinz bodies in bite cells. This is G6PD. Cervical hyperextension, lower motor neuron lesion in the upper limb. This is actually the lower motor neuron lesion in the upper limb and upper motor neuron lesion in the lower limb. Organism causing gastritis, simple MCQ, H. pylori. Side effect of thiazide diuretics, that is hypokalemia. But it also causes hypercalcemia, and it also causes poor glycemic index. It causes hyperuricemia. It causes hypertriglyceridemia. The hypothyroidism is associated with increase in. Now coming toward that, I think we are having 3 pages left. The cholesterol, because in liver you are having LDL receptor which take cholesterol and excrete it in the bile, and these receptors are produced by thyroxine. If there is no thyroxine, there will be no receptors, and there will be decreased uptake of cholesterol, and the cholesterol in the blood increases. That is the reason why hypothyroid patient is having high cholesterol, and this cholesterol deposit in the blood vessel. So hypothyroidism causes diastolic hypertension. There is increased resistance, and hyperthyroidism causes systolic hypertension because of increase in heart rate. Enzyme that break down the plasma triglyceride is lipoprotein lipase. Case of soldier coming from CHN with hypoxia. Now if they are asking about the cause of hypoxia, then this is pulmonary edema, high altitude pulmonary edema. But if they are talking about effect of high altitude, the answer is polycythemia, and this is the secondary polycythemia because this is caused by hypoxia. How do you differentiate between primary polycythemia and secondary? The answer is erythropoietin level. Erythropoietin level. If that is low, then it means this is primary, and if it is high, then it means secondary. Secondary means it is caused by hypoxia. So hypoxia increases the erythropoietin, and that causes increase in RBC mass. Coming next, regarding skeletal muscle nuclei located at periphery. Landmark muscle used to pass VP line sternocleidomastoid. Calculator the alveolar ventilation, the right one. For calculation, I will make another video. There are a lot of calculation in the exam. They are repeating. Cardiogenic shock is a complication of MI, and the drug of choice for hypotension in cardiogenic shock is dobutamine. In the CCF, drug of choice is dobutamine. To prevent bleeding in a patient receiving warfarin. Now they are asking about prevent. The answer is vitamin K. If they are asking about to treat the bleeding, the answer is prothrombin concentrate complex. If that is not in the option, then FFPs, fresh frozen plasma. And if asked what is the immediate effect, what would you do immediately? The answer is FFPs, not vitamin K. And how long vitamin K takes for the clotting factor to release into the blood? That is 12 to 24 hours. Reference step 3 USMLE. Diabetic foot ulcer with a decreased sensation, angiopathy and neuropathy. Coming next, derivative of foramen cecum thyroid. That is the statement. Conducting system of the heart lies in the subendocardium, mentioned in Tanveer. They have written in the SA node, AV node location and the conducting system. During ovulation, the oocyte lies in secondary oocyte. The answer is A. I will make another video on this. When is the primary oocyte, when is the primordial follicle, when is the secondary follicle, when is the primary follicle, what is the status during ovulation, what is the status before ovulation, what is the status after ovulation, what is the status before fertilization. Positive feedback mechanism, childbirth. And another is blood clotting, that is also positive feedback mechanism. Nucleus ambiguous 9, 10, 11. In medulla, now you are having the midbrain, pons and medulla. The second and third lies here, then the next fourth lies here, and the next fourth lies here. So you are having third, fourth, you are having 5, 6, 7, 8, you are having 9, 10, 11, 12. So they are talking about these three and they arise from the medulla. The phagocytes, they derive from bone marrow. Now I will discuss some of the MCQ with here. The B lymphocytes, sorry, I will change the color. The B lymphocyte originate from the bone marrow and developed inside the bone marrow. The T lymphocyte, it derived from the bone marrow and it develops in the thymus. The T lymphocyte is decreased in, the answer is cortisol. And there is another MCQ on T lymphocyte. The development of T lymphocyte and the life cycle of T lymphocyte is controlled by hormone called thymosin. Thymosin from the thymus. If that is not in the option, then the next best option is growth hormone. This is not thyroxine, growth hormone. So coming next, for diabetic nephropathy diagnosed by microalbuminuria. If the question says best initial pathology lies in increase in GFR. That is the right answer, increase in GFR. But over here the answer is D, microalbuminuria. Coming next statement, study by itself. Platelet transfused at room temperature because optimize the platelet function. Pregnant female with multiple times abortion could cause antiphospholipid antibody syndrome causes multiple abortion. What is the treatment for that? Loprin, usually Loprin. But if asked about pregnancy, then Loprin plus heparin both. Loprin plus heparin both. Coming next, so we are left with the 2 pages. Dysplasiacar epithelium. Test to confirm an 8-month-old child. So that is the PCR, because the antibodies from the mother cross to the placenta. PCR is highly sensitive and specific. Local anesthetic first effect unmyelinated fibers, because there is no insulation to them. Difference between Csf and plasma, that is low glucose. In Csf, the glucose is 2/3 of plasma, so that is low. If that is not in the option, then pH. Next best option is pH. Csf pH is low. Increased neural activity before voluntary fine movement is cortical association area. Breastfeeding should be started immediately after birth. If that is not in the option, then look for the word that is has shortest duration. The answer over here is half hour. Menopause finding statement is right. Increased CVP due to, now these are the things in pulmonary artery. This is the reason I am discussing these MCQ, so that you do not pick the wrong option. These are the increased TPR, decreased TPR. They are talking about the pulmonary arteries. So in the pulmonary artery, let's suppose discuss that. This is your jugular vein, and this is the right atrium, and this is pulmonary artery. So this is pulmonary artery, this is the right ventricle, this is the right atrium, and this is the jugular system. So what happens if there is increased resistance over here in the pulmonary artery system? In the pulmonary artery system, if there is increased resistance, what here? There is pooling of blood in the right ventricle, and this pooling of blood in the right ventricle goes up into the jugular vein, and there is increased CVP. So anything that decreases cardiac output of the right ventricle, that will give you increase in CVP. Increase in blood volume also give you increase in CVP. But if the question is like this, as it is written, increased TPR, even if there is increased TPR in the systemic vessel, what happened? That transferred back into the right ventricle, and that would give you raised GVP. Hypertension with adrenal artery thrombosis, renal instability, what will happen? Now it is actually increased peripheral resistance by angiotensin 2, because angiotensin 2 is a powerful vasoconstrictor. This is another MCQ. Which of the following is powerful vasoconstrictor? This is angiotensin 2, 1000 times that of the ADH, another hormone. Lateral body of the unigenital diaphragm. There is ischial ramus and pubic ramus, that is the right. Primary TB, parenchymal lesion with spread to lymphatics, the right answer. Albumin does not cross basement membrane due to negative charges because they are repelled. And the negative charges on the basement membrane is due to heparin, proteoglycans. These are the proteoglycans, heparin. No history of heart disease or poisoning, HB normal. Again, picture is very clear. Decreased oxygen from the outside. Regarding breast anatomy, this is repeating 15 to 20. Cause of decreased lymphatic flow, answer is hemorrhage. Because the lymph is formed from the blood, if there is hemorrhage and there is decreased blood going to the lymph, there is decreased lymph formation. There is decreased lymph formation. Internal oblique form what? The internal, you are having actually the external oblique and the internal oblique. It forms cremasteric fascia and cremasteric muscle. That is missing. So the answer over here is conjoined tendon. Transversus abdomen muscle and internal oblique, they form conjoined tendon. The external spermatic fascia is formed from the external oblique. Then the internal oblique form the cremasteric fascia. Cremasteric fascia. The transversus abdominis does not contribute toward this, and fascia transversalis form the internal spermatic fascia. Fascia transversalis. We'll discuss in the end. Pre-malignant nature of the vulva, Paget disease. Which of the following has highest chances of developing endometrial cancer with atypia? Complex hyperplasia with atypia. For anatomical landmark, arachnoid space is from foramen 2 to S2. Coming next. Now this may be a poor recall. Left adrenal gland blood supply. Now coming toward that. Don't know what is the. This is the poor recall. So we have to discuss the blood supply. Now first focus on this diagram. Can you appreciate this thing? This is external. You can see external spermatic fascia, cremasteric fascia, and you have internal spermatic fascia. This external spermatic fascia is the continuation above from the external oblique. Then you are having cremasteric fascia. This is the continuation of what? This is the continuation of internal oblique. And then you have the inner layer coming toward the inner layer. And this inner layer is actually the fascia transversalis, that is called internal spermatic fascia. This inner layer. Now which layer does not participate? That is transversus abdominis muscle. So these are the separate MCQ I am quoting. Transversus abdominis cuts over here. It does not go beyond that. It does not go beyond it. There's another MCQ regarding this. I have discussed that in my previous lecture, so you can watch them from there. Blood supply of the left adrenal gland. You see there is superior adrenal artery, middle adrenal artery, and inferior adrenal artery. The superior adrenal artery is a branch from the inferior phrenic artery, while the middle adrenal artery is a direct branch from the aorta, and the inferior phrenic artery is a branch from the renal artery. And then the adrenal vein drain into renal vein. On the right side, the adrenal vein drain directly into the inferior vena cava. This is another MCQ. This is another MCQ. Left anterior vein is the larger as compared to the right. This is another MCQ. Left renal vein moves in front of the renal artery in aorta. This is another MCQ. So with this, paper is finished. Thanks for watching and share.